Hi. Good afternoon, everyone. Sorry, good evening, everyone. How are you all doing? So, you're welcome to another episode of Smart Parenting Workshop with Oluwatoyin Ogunkomi. And today, I have an awesome topic that we're going to discuss. We're discussing mental health first aid for parents and caregivers. So, over the years, working as a clinical psychologist, have had to intervene in so many cases. And one of the most, I won't say traumatizing, but one of the things that parents say most times, or the things parents say when their children have one mental health issue or the other is, why didn't I know on time? Why didn't I get to know about this on time? Why didn't somebody tell me about what mental health or what mental challenges are all about? So today I'll be talking about what mental health is, what mental illnesses are. I'll also talk about what mental first aid is. So for those of you who are joining for the first time, maybe you stumbled upon this video, my name is Oluwatoyin Ogunkomi. I'm a family psychologist. I work with parents and adolescents of African descent. I provide them with tools and resources on how to navigate life. I also provide them with mental health tools so they can live thriving lives. So, like I said, today we're talking about how parents or caregivers can provide mental health first aid to their words. So, when we talk about mental health, what really is mental health? So, part of the things we need to know, part of the things I'll be talking about today, I'll be talking about what mental health is, what mental health first aid is. I'll be giving techniques to mental first aid, and also talk about the role of the family when it comes to mental health first aid. So, let's go straight in. So, as you're joining, I would like you to tell me where you're watching from. As you're joining, I'd like you to, if you're going to watch the replay, also type in where you're watching from. So if I ask a question, how many of us have heard about mental health first aid in the past? You can go into the comment section and type it in. Have you heard about mental health first aid before now? Mental health first aid, just like normal first aid, is the first response given to is the first response that is given when someone is in mental distress. But before we go into the definition of that, I'll just talk about what mental health is. Mental health, according to the World Health Organization, has been defined as the state of well-being in which an individual realizes his or her abilities, where this individual can cope with the normal stress of everyday living, and also the person can work productively, learn productively, and the person is fruitful and able to contribute to his or her community. Quite a mouthful, right? Yes. So let me just say it again. So, what is mental health? According to the World Health Organization, mental health is a state of well being in which a person or an individual is able to identify and realize his abilities. The person can cope with the normal stress of daily living. The person can work productively. The person can function and contribute to his or her community. Mental health is a spectrum. It's on a spectrum. It's a continuum. So it ranges from having very good health, mental health, to mental disorder. So a person with great mental health is in control of his emotion. Person with great mental health has good cognitive functioning. The person with mental health is able to interact positively with people around, and they're also able to perform their work well. They're able to study well. They're also able to function well in the family. So there are four criteria. Number one, person is in control of his or her emotions. The person has very good cognitive functioning. The person is able to interact positively with people around them, and the person is able to perform well either at work, in school, or in the family setting. That is what mental health is. So I asked the question. Thank you for joining. I said, have you heard about mental first aid before? If yes, can you go into the comment section? Just tell us what you understand by mental health first aid. That would be I would like to know what you know so I can add and build onto your knowledge base. So mental health, like I just defined mental health. I said mental health, that a person that has great mental health is someone who is in control of his emotion, someone who has good cognitive abilities, someone who is able to interact positively with people around him or her, and the person is able to function well either at work, in the school, or in the family setting. So mental health is it's something that we all need to know about. We all need to know about mental health. We all need to know about mental disorders so that we can be in a place to provide immediate help for people around us. So when we talk about mental health, I also talk about mental disorder. So what is mental disorder or mental illness? Mental illness is a state in which a person is not in control of his or her emotion or thought. So we can say somebody has mental distress or mental illness when the person is in a state that affects the way the person thinks, the way the person feels, the way the person acts. These states would disrupt the person's ability to work or the person's ability to carry out his or her daily activities. And mental health is a broader term for different challenges. Mental illness is a broader term for different challenges, that different forms of mental disorders. We have depression, we have anxiety, we have phobias, we have bipolar, we have schizophrenia, we have post traumatic stress disorder, we have personality disorders, we have substance use disorders, we have eating and gambling disorders. There are quite a lot of mental health challenges. This is just like a brief, just a brief. So, as parents, as caregivers, it's very important that we understand the signs and we're able to identify the signs and symptoms of mental illnesses so that we can provide immediate intervention. Mental health first aid is about providing immediate intervention. Now, research has shown that the period of onset of mental health challenges and the time the patient gets treatment should not be too long, because untreated period can cause a lot of havoc and it will be very difficult for the person to return back to the premorbid state. So it's important as parents to understand this. It's important as caregivers to understand this, that the period of onset of mental health challenges and treatment should not be long, because the longer the onset or the longer the untreated period of the untreated period, the more difficult it will be to take the person back to the premorbid state. And what do I mean by premorbid state? Premorbid state is the way the person was functioning before the onset of the disorder. And this is one of the reasons it's important for individuals to get timely help, especially people who are suffering from schizophrenia or any other form of mental illnesses, because early intervention of mental health challenges can lead to a better outcome. So for caregivers who are here, for parents who are here, it's very important that we understand, we're able to identify these signs. Working in the clinical settings, I've seen cases whereby patients were suffering from mental disorders right from their teenage years. But because the parents did not understand, the parents were not able to identify these signs, these signs, these symptoms lingered on for a long time until the child started harming himself and started harming other people. So it's important as parents to know that immediately we see, I'm going to talk about the signs, immediately we notice any sign, we notice anything strange in the way our children are acting, in their thought processes, in the way they speak, in the way they express their emotions, or in the way they act. Please, it's important that we intervene immediately, because early intervention can lead to better outcomes. Individuals who don't get help on time, they tend to it tends to be very difficult to take them back to the pre-morbid state. As parents, it's very important that we step in. We are able to identify these challenges, because if we're not able to identify these challenges, it might cause a lot of havoc in the life of the child. So what really is first aid mental health first aid? Mental health first aid is the ability to identify, understand, and respond to signs of mental illnesses or substance use disorder on time. It involves you having skills to reach out for help, skills to provide initial help, skills to support the individuals. And it's important that, just like the physical first aid, maybe somebody there's an accident, and the physical first aid we want to give, maybe to stop the bleeding, to ensure the person does not have concussion and all that, is the same initial assistance that should be offered to individuals suffering from mental health problems. And as parents or caregivers, it's important that we identify the signs of mental health challenges or mental illnesses. So what is the aim of mental health first aid? Number one is to preserve life, just like physical first aid. The first aim of mental health first aid is to preserve life. The second is to provide help to prevent the problem from becoming more serious. So the first aim of mental health first aid is to preserve life. The second aim or objective of mental health first aid is to provide help to prevent the problem from becoming more serious, is to promote and enhance recovery, is to provide comfort and support through the escalation of the situation. So, for example, there's a child that is going through panic attack. What can you do as a parent? How can you help out so that the panic attack does not become something more serious? You have a child that is at home, that is sad, that is always has mood change or mood swings. What can you do to interfere or to help the child so that it does not lead into a more serious issue? Then another objective of mental health first aid is to know when to refer the person to a professional. So part of the things you need to know about mental first aid is that mental first aid is just for you to identify the signs and symptoms for early intervention. It's not for you to offer or to diagnose what is wrong with the person. Now, it's important to know that we should not ignore the signs when we see these signs, or to assume that these or to assume that they will just go away. They won't. I've seen cases where there was a particular patient that called me and said, "Oh, she's feeling depressed, she's feeling sad," and I asked, "Have you spoken to your parents about it?" Because any child below 18, I always ensure that their parents they come to me with their parents. I don't see adolescents without their parents. But from age 18 upwards, because they're adults, yes. So I said, "Have you spoken to your mom about this?" And the child said, "No, my mom said there's nothing wrong with me. My mom said it will go away." As parents, as caregivers, it's important that we do not ignore these symptoms. And it's important that we do not assume that these symptoms will go away, because they won't if you don't do something to it. Now, the first step in becoming a mental health first aider is knowing and identifying the different signs and symptoms of mental health challenges. And like I said, you knowing these signs, you identifying these symptoms does not make you a clinician. It just makes you someone that is more aware. And, like I said, it's for you to prefer early intervention. So, what are the things you should look out for? You need to look out for changes in the person's behavior, changes in the person's mood, changes in the person's energy level, habit, or personalities. There are different signs to different mental health issues. Like I stated when I started, I said we have different mental health illness, mental disorders like depression, we have anxiety, we have bipolar, we have post-traumatic stress disorder, we have personality disorders, we have substance use disorders, and we have eating and gambling disorders. So, as parents, what are the signs you should look out for? What are the signs you should look out for? So, I'm going to mention some signs, just a few signs, general signs you should look out for that could help you know that there is something wrong with the child or with the person that's in your care. So one thing you need to know, when for mental health, for a case to be termed clinic, for someone to be termed clinically, to have a clinical illness, mental health illness, that means these symptoms have gone on for more than 2 weeks, and these symptoms have affected the person's ability to function. So the person is not able to talk or interact with family members, the person is isolating himself, the person is not able to go to school, or the person is not able to go to work, then would say that the person has a mental illness. So, what are the symptoms we need to watch out for as parents? Number one, person is withdrawing from friends, or the person has stopped doing certain activities he or she used to do in the past. The person is significantly tired. A person has low energy, the person has problems sleeping, the person feels detached from reality. Maybe the person is delusioned, the person is paranoid, or the person is hallucinating. When we say somebody is hallucinating, this person seeing things that visual hallucinations, the person is seeing things that are not there. Auditory hallucinations when the person is hearing things that are not there. Then tactile hallucinations when the person is feeling things that are not there. That's when we say the person is detached from reality. Another sign parents can look out for is inability to cope with daily stress. So maybe the person has missed his flight or person has missed the school bus, and that's normal stress, right? But the person cannot cope with it, and the person is, getting distressed, is getting hyperventilating, is having a panic attack. That is a sign that there's something wrong. Then the person is not able to understand and relate to situations or to people. That's a sign that something is happening. The person is always feeling sad. The person has been feeling sad consecutively for 2 weeks. That's a sign that there's something wrong. The person's thinking is confused. The person does not have the ability to concentrate, or person does not have the ability to think the normal way he or she used to think. Then that is a sign that there's something wrong. Then another sign is excessive worry. Person is worrying too much. Oh, what is about to happen? Worrying about things that will happen in the future, or things that might not even happen in the future. The person is extremely worried. Person has extreme fears. That's a sign that something is wrong. Person is feeling guilty all the time. Why are you feeling guilty? What have you done wrong? I just don't know. I just feel guilty. I feel I've not done the right thing. I feel, like the person just feeling guilty for no reason. That is a sign that there's a problem. Then, when we talk about change in the person's mood, 1 minute the person is extremely happy, the next minute the person is extremely sad. Person is moving from one mood to another mood, having different mood swings. That's a sign for concern as a parent. Or the person is having problems with drug use or alcohol use, or the person's eating pattern has changed. Is that the person is eating too much or is eating less? or the person has excessive anger, the person is hostile, the person is violent, or the person has suicidal thoughts, or in terms of sex drive for couples, just notice that your partner's sex drive has changed. There's signs for concern for that. So, as parents, what can we do? What is mental health first aid? So, for mental health first aid, there's an acronym for the technique to use, the action plan, and it's called ALGEE, ALGEE. So, 5 steps to helping your teenagers or your world or anyone around you, basically. 5 things you can do. The first A stands for you assessing the situation. You need to check to ensure that the person is not at risk for suicide, the person is not at risk to harm himself or to harm other people. If the person is at risk of suicide, or the person is at risk of self-harm or any other thing, immediately please refer the person to a professional. There's no need of going to the other steps. The moment you can identify that the person is at risk for suicide or harm, so what can you do? Ask questions. Be able to ask questions. Oh, I noticed you're distressed. How would you like me to help you? Are you thinking of killing yourself? Ask these questions, because if you don't ask these questions, you wouldn't know what the person has planned to do. So ask questions. Have you harmed yourself? Do you feel like harming yourself? Why do you feel like harming yourself? Ask questions, please. So the first step in mental health first aid is to assess the situation to ensure that the person is not at risk for suicide, or the person is not at risk for harming himself or other people around. Assess the distress. Is it an emotional distress? Is it a behavioral distress? Is it a cognitive, a social, or physical distress? Ensure that you are able to assess the distress. Approach the person, speak with the person in a safe environment. You need to learn to create like a safe space for the person to open up and speak. And this takes me to the next step, that's the L, which states that you need to listen non-judgmentally. So you've seen someone is distressed, you've seen someone is feeling not too good, and the next thing is you're accusing the person. No, you have to listen without judgment. Listen non-judgmentally. Use empathy and active listening skills, like paraphrasing what the person is saying. This is to know the exact need of the person, not blaming or shaming the person, but listening to understand how you can help. So, as parents, you can see your child is distressed, emotionally distressed. What's wrong? What's happening? And the child goes and says, "Oh, my boyfriend jilted me. That's why I'm feeling sad." I know some others will say, boyfriend, it's because of boyfriend, you're we can go on and on. That is not the time to blame, please. Or your friend comes home, your child comes home and says, oh, my friends are not talking to me, everybody is not talking to me, I'm feeling so sad. And you will now go, why would you feel sad? What is there? Yeah, you have other people to. No, this is the time to listen without judgment. Listen without shaming or blaming the child. This is the time for you to listen, to understand how you can help. Listen without interruption. Listen without offering any unsolicited advice at that point in time. As parents, it's important that we allow this child to express how they feel. Let them express how they feel in their own words. Let them express what they are thinking. It's very important. This is not the time to shame. This is not the time to blame, but this is the time to listen as parents, especially parents to adolescents. This is the time for you to listen. Your daughter might be going through certain mood swings. Your son might be having some anger, some things happening to him at that point in time. Just listen. Your job is to de-escalate the situation, not to aggravate the situation. As parents, it's very important that we learn how to de-escalate rather than aggravate the situation. So the first one I said is to assess the situation. The second is to listen without judgment. The third is to give reassurances, hope to the person that don't worry, you're going to get help. We're going to help you. We're going to work with you. We're going to walk you through the path of recovery and of healing. It's very important that we do this, please. Let's learn to, give reassurances. Then the next E is you encouraging appropriate professional help. So you've been able to identify that the child is not doing too well. The child is moody, the child is feeling sad, the child is getting angry all the time. And this thing has been going on for more than 2 weeks. Please, it's important that you seek professional help. Encourage the child to see a professional. I know one thing I noticed that it's not everyone that feels comfortable speaking with a stranger. So children with their children, some children would prefer to speak to their parents first. That's for those who have very good relationship with their parents. They'll prefer to speak to their parents first rather than going to speak with a professional. So as parents, when your child is speaking with you, when they're speaking to you, when they're speaking with you, please also encourage them to get the appropriate professional help. Identify when to seek professional help. Identify when to go and see a professional like a clinical psychologist or a psychiatric doctor. But it's important. Then the second and the last E is you need to encourage self-help. So you have a child that is feeling this depressed or it's anxious. What are the things the child can do on his own to de-escalate the situation? Encourage self-help, promote healthy coping mechanism, like teaching the child how to take in deep breath, doing breathing exercises, counting 1 to 10. It's important that we help our children to equip them with skills to de-escalate situations. So they find themselves in a situation where it's them tensed up in school, instead of them throwing tantrums, instead of them getting angry, teach them to count 1 to 10. Teach them to walk away from the stressful situation. Teach them to take deep breath. It's very important that we teach our children self-help and other coping strategies. So let me go over the mental health first aid techniques. The first one is for you to be able to identify the situation, is for you to assess the situation, to ensure that what your child is going through. Okay, so we have some comments here. Somebody said, they don't know feeling guilty was it. Oh, yes. Feeling guilty is actually a sign of someone that is actually depressed. So this is just one, that's just one of the signs of depression. The person is always feeling guilty, not knowing, just feeling guilty that, and the person really has no reason to feel guilty. Why are you feeling guilty? I don't know. I remember there was a particular judge. There was a particular patient. It is actually a chief judge, right? That I attended to, and the person had depression with anxiety, and the person the guilt was so much, the person couldn't go back to work. So one of the things about mental health is that it affects the person's functioning. So because the person was feeling so guilty, the person just couldn't go to work. Why are you feeling guilty? I don't know. I just feel I've not done the right thing. I feel my work is not good enough. The person was just feeling guilty. For some, they might actually have valid reasons for feeling guilty, right? But yeah, there's nothing wrong in feeling guilty. But if it persists, if it persists continuously for more than 2 weeks, then there's a problem to it. Thank you so much, Daniela, for that question. So back to I was doing like a recap for the 5 steps for mental health first aid, the techniques. I said the first step is for you to be able to assess the situation. You're able to identify what is wrong with it. You're able to identify the signs, and you're able to understand, okay, there's something, this child is not the way he or she used to be. There's something off, the way this person is talking, the way this person is acting, the way this person is communicating. There's something off. So assess the situation. Ensure that the person is not at risk for suicide, or the person is not at risk for self harm or any other self harm or to harm other people. Then the second step is you need to listen. So approach the person, approach your child, speak with the child in a safe environment. So if you've been able to identify that the person is not at risk for suicide or harm, speak to the person in a safe environment. Use have an open conversation. Use the I statement to express your concerns. You could use word like, oh, I have noticed that I feel concerned about, oh, these signs I'm seeing in you. I would like you to explain further what is really happening. It's very important that we approach our children and speak with them in a safe environment. I also spoke about listening non-judgmentally, listening without interrupting, listening with empathy, and using active listening skills. I also spoke about you listening, allowing them to express how they feel, allowing them to express their thoughts without you being judgmental, and let them express themselves at their own pace. Don't rush them. Don't say, oh, yeah, 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 say, what is it, what is it? Mm-mm. Calm down, let them speak to you at their own pace. Them being able to speak to you at their own pace gives them this reassurance that you are really interested in them. But if you hurry them up, or if you shut them down, or if you don't really listen to them with empathy, it shows to them that you're not really interested or bothered or concerned about them. So imagine you started your conversation by saying, I feel so concerned about you. I've noticed that, and you're telling and the person is now talking, and you're like, hey, 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 talk. It shows that you're not really concerned. So as parents, let's learn to listen without interrupting them. Let's learn to listen without shaming or blaming them. Then I also spoke about giving them reassurances that there is hope, and that they can get help and get better. Ensure that you give them accurate information. Don't tell them what you're not sure of. Don't guess information and tell them, and do not promise them what you're not sure of, please. And that's why it's important as parents and caregivers to equip ourselves with tools, with resources or information about everything that has to do with raising children. Their mental health is part of raising children. Physical health is part of raising children. Their academic, their cognitive, their social, their spiritual, all these aspects. It's important that you equip yourself with skills and with information so that you are always able to give the right info. Then I spoke about encouraging the child to see a professional. I said that there are times children wouldn't want to see a professional because of the stigma. They say, I don't want to go and see a psychologist, though. I don't want my friends to say there's something wrong with me. No, going to see a psychologist or therapist is to get help. It's better for you to get help than for you to stay at home not getting help. So as parents, we need to encourage them to seek professional help. Then I also spoke about encouraging them to seek self-help. What do I mean by that? Teaching them coping skills, coping strategies, how to handle stress so that it does not escalate to something bigger. Teaching them how to build a support network, teaching them about sleeping well, eating right, and exercising regularly. Very, very important. Sleep, eat, and exercise. These three things are very, very important for our children. Then, in conclusion, I'll be talking about roles of family members. So I've spoken about roles of the parent, how to help. It's very important that so one of the recovery capitals when it comes to mental health is the support of family members, support of the family. It's very important that as parents, as teachers, as caregivers, we need to be mental health first aiders. We need to be able to support our loved ones when they're going through one form of mental health challenges or the other, because this will make their recovery faster. This will make their recovery easier for them. Most of my patients that have recovered fast are those patients whose parents are involved in their recovery. Patients that I've noticed that don't heal faster enough are those whose parents or family members are not involved in their recovery. So, as parents, your role in the recovery of your child is very, 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 very important. Your role in the recovery of your child is very important. People recover faster when they're given sufficient support and sufficient support. As parents, remember that being a mental health first aider is not about you diagnosing or trying to be the psychologist or the therapist, but it's just to give early intervention so that the child or the individual does not suffer in the long run. Like I said, mental health first aid is to help the patient get back to premorbid state. So once the untreated period of mental illness is short, it's easier for the person to go back to premorbid state. So I just want to say thank you so much for you for listening. If you have any question, I would really like you to ask questions before I shut down. Thank you so much. So I started by talking about what mental health is. I spoke about what mental illnesses are. I spoke about the different signs and symptoms. I spoke about different types of mental illnesses, depression, anxiety. I spoke about schizophrenia. I spoke about post traumatic stress. I spoke about bipolar. There are different mental health challenges. And as parents, you need to be able to identify the different signs. I spoke about the signs to mental health challenges. And I also spoke about what mental health first aid is and the mental health first aid techniques. Thank you so much, everyone, for joining. Do you have questions? Do you have questions? Do you have any question? You can always drop your question in the comment section. Thank you so much, everyone, for asking. And if you need a psychologist, you can always call me. I'm going to put my number here. Let me see. I'm going to put my number here so that let me use this. I'm going to put my number here so you can always call me in case you're not sure and you just wonder what's happening to my child. I'm going to put my number here. 356. You can always call me. Let me see. Yep. Okay, so I've put my number there. You can always call me in case you have any question. If you have anything, give me a call. I'm always available. Thank you so much for joining. It's really nice seeing you. Okay, we have a comment. Let me see. How can you talk? How can you get a child to talk? Okay, so part of the things you can do to get a child to talk, like I said, you need to assure the child that you've got his or her back, and that anything the child is about to say, you're going to talk about confidentiality. And also, you need to be able to build rapport with the child. For parents, it's difficult for parents who do not have a good relationship with their children it's difficult for parents who do not have a relationship with their children to get them to talk. And that's why it's very important that you build a healthy relationship with your children. One of the things we do at the Smart Parenting Academy is that we have this program called Parent Teen Bonding Challenge, where we teach parents how to connect with their children so that they can get them to talk. So building rapport is very important as parents. You need to build rapport. You need to build um, create that open space, have an open channel of communication where your child can speak to you and say anything to you without you being judgmental. When we are judgmental, our children find it very difficult to speak to us. When we blame and shame them all the time they come to talk to us, they wouldn't want to talk to us. Also, when you're not emotionally available for them, they wouldn't just won't want to talk to you. Thank you so much. So I guess we'll be ending here now. Do you have any other question? You can always drop your questions in the comment section, and I'll always go in there to. Thanks. Oh, you're welcome, ma'am. Thank you so much. So have a nice day, everyone. Next month, hopefully, we'll have another session on parenting and mental health of our adolescents. Thank you, thank you, thank you. Have a nice evening. Bye.